Alright everyone, so we've all seen the new CMS rules about how we have to record your calls. In today's video, I'm just going to go over some frequently asked questions, kind of what you have to do. If you are not a plan advisor or have a integrity company kind of FMO and have access to Medicare Center, that's okay. These rules will still apply to you in the broader sense, but you won't have access to Medicare Center's call recording tool. If you want to join plan advisors or Medicare Center, have Medicare Center access, and you're a licensed health insurance agent, you can let me know, reach out, and I will see if I can help you. If not, I'll refer you to somebody who is better suited to help you grow as an agent. Anyway, so Medicare has released new rules, and number one, they made it mandatory for agents, that's anybody now, not just call centers. I initially thought this was only for call centers, but for anyone who is a agent, anyone who is a third-party marketer, like who has a contract pretty much to sell Medicare Advantage and Medicare Part D plans, needs to record your calls. And also there's a new process for marketing materials, and the term marketing has expanded as far as the kinds of marketing materials that need to be submitted to CMS. Okay, so let's go ahead and take a look at the frequently asked questions, because a lot of times that's a little bit better resource than reading the actual thing. Again, none of this is to be construed as legal advice. Please read the document thoroughly to get more clarity. But this is the, I read this past weekend, and I think it's the most comprehensive FAQ that I found yet. And again, this ruling just came out recently, so there may be better guidance coming up. But as of right now, August 1st is the best I found. So do I really need to record all my calls with clients? And the answer is yes. You must record all calls with beneficiaries in their entirety, including enrollments. That's going to suck, but it's going to be what we have to do if we want to be in compliance, and you always have to be in compliance. Okay, so just going to clear it up now. You have to keep these recordings for 10 years, just like a scope of appointment. Are there any new requirements for lead generating activities? Again, there are. So you have to disclose to the beneficiary that they're being transferred to a licensed agent who can enroll them into a new plan. And let the beneficiary know that his or her information will be provided to a licensed insurance agent for future contacts. So this is for lead generations. If you're hiring or if you are having any kind of lead generation flyers, then these things have to be disclosed on those flyers. Or if you have a lead person who is, collecting information for, for Medicare beneficiaries, and you are intending on enrolling them in an MA, MAPD, or PDP plan, this disclosure has to be provided. And you've heard that there's a special new disclaimer that you have to provide, and that is right. So here is it. I believe it has to be read verbatim. And I quote, "We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all your options." So initially, this to me sounds like they are trying to make us sound inferior to Medicare.gov. And I'm going to tell you right now, as an agent who's been doing this for 8 years, the people at Medicare, oh my goodness. If they think that people at Medicare.gov, while yes, they have more information than we do, we have far more experience and far more conviction and are far more committed to our clients and the people we talk to on the phone than Medicare.gov and 1-800-MEDICARE would. Just on a base whole, or at least I do anyway, that it's understandable that they have to put this on there, but it's just, to me, it doesn't make sense. that it's a mandatory disclaimer that we have to say to all of our clients. Okay, and here it is. So it has to be made verbally within the first minute of the sales call. It has to be said on all electronic communications, online, email, chat, or any other electronic communication. It has to be on the website, on all of the marketing materials. We don't have to do this, of course, when we're meeting in person, or if you are, let's say you're working for XYZ Medicare Advantage plan, you don't have to have this disclaimer because they should already know. And, or if you sell all commercially available MA or MAPD plans in a given service area. So if you are licensed and appointed to sell all of them, then it's okay. And I would, if this is your out, I would not use this as the reason why you're not, because there are so many Medicare Advantage and PDP plans. Even if you think you're commercial, or if you are contracted with all of them, I'm gonna say you probably aren't. There could be one MAPD plan that's offered by like a closed hospital system that you might not have access to, and then you're screwed if you think you use this as the way out. So don't. Just unless you are one of these, in one of these circumstances, just don't. I'm an independent agent. Do I have to follow this? Yes, these are to all third-party marketing organizations, which is everyone pretty much who is not working for a singular healthcare company. And it's not just enrollment calls, it's all calls with every beneficiary in their entirety. This includes all inbound and outbound calls, as long as the full chain of enrollment, including lead generation, marketing, and the enrollment process. So this is not just recording the sales presentation, enrollment application, payment information, demographic verification. This is everything. And the only way you can decide not to record it is if you are calling or you're talking with the client, and it's not going to be anything with the chain of enrollment. Chain of enrollment, again, inbound, outbound calls, lead generation, marketing, and enrollment. So if you're calling them to check and see if they received the card, doesn't need to be recorded. If you're calling them to see how they are doing, happy birthday, those things you don't have to record. But once you're calling and discussing either marketing, you're thinking about enrolling them in a plan, then you need to start recording anything. Even if it's a mid-year review, discussing options, annual check-in, then you need to record. So like I said, if it's a courtesy call, a wellness call, or a happy birthday call, no need to record. But if it's anything to do with Medicare period, you need to record it. And they should be recorded from the onset of the call. And you need to record the individual's consent to be recorded on the call. And the disclaimers only need to be read on the first minute of a sales call. This is for that special disclaimer though of the I'm only I only can well, let's just read it so that I'm not speaking. We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. We do offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all of your options. So this is for new enrollees, new people you're talking to, not if you have already talked to them before and now you're on to the sales presentation or you're on to the enrollment portion. You would not have to submit the special read the special disclaimer, but you will have to record the call. Okay. How long or how can I record calls while staying compliant with state recording laws? Okay, so different states have different recording laws. You know how you hear that this call may be recorded or monitored for whatever purposes, quality assurance purposes, yada, 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 right? Some states require you to make that disclosure, while some states are states where you don't need disclosure for them to record. Unfortunately, because Medicare is all over the country, you should tell the customer every time you will. I mean, don't record it without their understanding. And then, of course, make sure that the notification is documented on the recording. And also, if you do have a pre-recorded disclosure of this call may be recorded, yada, 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 if they stay on the line, that is consent. So that is something where you are able to kind of get around with verbally telling them. You may be able to just have the recording show up first, and then that way they know that all of these things are pre-recorded, or are not pre-recorded. All these things are going to be recorded, all the calls. Now, in the case that the customer does not want their call to be recorded, I can understand this. But this is what you would say. I understand, or something like this. I understand that you do not wish for the call to be recorded. I'm going to read it like I'm reading off the sheet, but please read it like you would be reading it to a normal human being who is, you were trying to get to understand this. Okay? I understand that you do not wish for the call to be recorded. However, new government regulations require certain calls with Medicare beneficiaries to be recorded in their entirety. The purpose is to maintain quality and help ensure that the information that you receive is accurate. Does this make sense now? And if they say okay, then state okay, this call is being recorded, and continue the call. If they still don't want the call recorded, you need to tell them that you cannot continue with the call. Okay? So for me, I'm most likely going to say, if they tell me, you know, you don't want the call recorded, I'm probably going to say something like, I understand, you know, I myself are uncomfortable with my calls being recorded because I don't know what they're going to be used for. I can tell you that these calls are being recorded because there has been a lot of fraud recently with Medicare beneficiaries and call centers, and Medicare has made new guidelines that everyone has to record their calls in case for some reason that there's some discrepancy between enrollments, and it is meant to protect you as a Medicare beneficiary so that Medicare can make decisions based on what was said during a call to see if there's any evidence that there was fraud or, you know, enrollment mistakes that were made, so that you can get the best Medicare services that you require. Does that make sense, or should I just stop the call now? And if they say stop the call, then there's really nothing we can do. And that's what I'm gonna say, simply because I'm pretty sure this is why Medicare did this, because there's a lot of fraudulent enrollments going on. But anyway, that's what I'm gonna do. All right, so I don't have the capability to record all my calls with beneficiaries. What resources does Integrity have to help? So this is where I said, you know, if you're not part of the Integrity family of FMOs, then it's not going to apply to you. But, you know, just look online how to record my phone calls on my blank phone. Like if you have an iPhone, then type in iPhone. If you have an Android, type in Android. You know, there might be an app or something that you can learn to use to quickly learn how to record calls. And remember, if it's not something that you normally did before, create some kind of reminder, like on your, I don't know, computer or something, like a post-it note, say, hey, record calls. Okay? And then this is where you can choose another different vendor. But remember, if you do use a different vendor, like that whatever phone recording thing I just recently talked about, you have to pay them if they have a fee, and you also have to keep those records for 10 years. Yeah, in this case, in our case, for people who are with Integrity, it simply is a call recording technology integrated into the technology. And you have to start complying with these new requirements starting from January 1st, 2023 enrollment year. So that means anyone you talk to who is going to enroll into a January 1st, 2023 starting date plan, you have to record. And that's going to, of course, begin October 1st when you can start talking about the 2023 plans. So here's some things you can do. Add the new disclaimers to all of your emails, to your websites if you have them, to your marketing materials, and the first minute of your sales script. Identify and make a list of all vendors, contractors, subcontractors who perform lead generation, sales, marketing, and enrollment related functions for you. And this, of course, help you prepare for reporting and contract updates as needs arise. So if you are, with integrity, then you know that the platform is most likely going to be updated when it has to be, by when it has to be. So there's no worry there. But if you are not with integrity or have other contracts that are not with integrity, then check on those field marketing organizations to see what they're doing in this, in light of this kind of new compliance. All right, how long do I need to keep my recordings? I talked about this a little earlier. 10 years. And Medicare Center will have the capability to record it and store it for 10 years. So it's great. You already have that kind of going on. If you have any questions about this, be sure to read the CMS guidelines, as I am not that versed in this. I'm just simply going to comply with these rules here. As part of the sales process, I'm going to integrate it within my sales process. So I'm not going to kind of create, additional or different processes to wiggle around some loopholes. I'm going to just comply. Hope that helps. You guys have a great rest of the day. Remember, do good things, help out your clients. Healthcare is really confusing. Help them out. Let them know that you don't know everything, and that the healthcare system is or does require guidance. And I hope you have a great rest of the day. Bye-bye now.